Hi guys, welcome back to Medical Coding with Blue. Today's episode is all about considering changing your career to medical coding, frequently asked questions. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. I have been a medical coder for over 10 years. I really love to share the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit that like button, and at the end of this video helps you, I hope that you will share it. So let's get started. All right, so you are considering a career in medical coding. Now, maybe you have a degree in something else that's not related to the medical coding field, or the medical field actually, and you're wondering, is this the right thing? Can you do it? If you were maybe like into software before, or maybe you were a nurse previously, or an LPN, or maybe you were a transcriptionist and you're thinking about doing this, or maybe you just had a completely different degree altogether, maybe something in engineering or something. Can you do this? Is this the right thing for you? Well, yes, you absolutely can. If you are looking to do this for whatever your reason, whatever the case may be. Some people do this transition into medical coding because they want to, if they were working with patients, they want to perhaps get out of that active patient hands-on care, and they want to do something still in the medical field, but something that is more, behind the scenes. And that is what we do. We have no contact with patients at all. So that is appealing to a lot of people. And with nurses, sometimes, because nursing is so physically demanding, I've seen a lot of nurses make that transition from nursing into medical coding. And the question is always the same. Is my previous background going to inhibit me, or is it going to make it easier? Can I get paid more because I have all of these other experiences? Or if I have an unrelated degree, can that somehow help me? When it comes to that, when it comes to having a degree that's unrelated or even related, it's going to depend on how well you can market that degree. How well are you displaying your talents, and what can you bring to this field? If you decide you want to go through a program and you have your degree from a previous profession that you did, and you are wanting to transition into this, think about all the good qualities that you had from your previous field, whether it's managerial experience, or whether it is experience with teaching in a crowd, or whether it is good time management, things like that, or whether you were like under the pressure of having like deadlines and things like that, and how well you were able to adjust to those things. Those are all things that you can add to your resume. Okay, it may not be related to medical coding, it may not even be related to the medical field, but it can give you a little bit of an edge. Okay, somebody that is very hands-on with like doing a lot of instruction and things like that would be appealing, because then that means you can work with providers. What we do is also work with providers. It's not just about reading documentation and then just sort of picking the codes and going from there. It involves a lot of interacting with very highly intelligent people. And that is part of the appeal, at least in my mind, into getting into medical coding, is working with very intelligent people. And I like that. I mean, because I embrace intelligence. I really like working with intelligent people. They are different. And the fact that they don't communicate the same as everybody else. You have to look and you have to study them, and you have to really try hard to understand them. And this effort pays off in dividends when you are trying to work with their documentation and work with them to improve their documentation, or whatever the case may be. This is a very good field for people who like to study. This is a field for intellectuals. It is. And it doesn't matter what your previous background was. Before I got into this, I was delivering phone books, and I was a bartender, and I worked at a halfway house, and I did food service. So I worked at a concession stand. There was a bunch of things that I did before this life as a medical coder, and I really enjoy it, and I wouldn't trade it for anything. But I always tell the people that ask me these questions, I used to work in IT. Do you think I can do medical coding? I think you can do anything you want to. Well, I'm a little older. I'm perhaps in my late 30s or in my early 40s or even in my 50s. Can I still do this? Is it still possible to change my career? Well, think about it. I mean, we're not allowed to retire until like we're in the 70s or something like that. So you still have plenty of time, right, to do a couple of careers in your lifetime. It's up to you if that is what you want to do. Is it worth it? Absolutely. Is medical coding worth it? It absolutely is, in my opinion. It's worth it because the challenge of every day, of learning something new, of never having the same thing over and over again, from working with these providers and their personalities, that is something that I value. That's something I like about this field. I like that I'm helping a patient even though I don't have direct contact with them. I'm behind the scenes. And I like that. I like that I help my providers and I make sure that they are well taken care of as far as like making sure that they're getting paid appropriately. I like that I'm their partner. And that is what a medical coder is. A medical coder is a provider's partner into making sure that everything that they're documenting is actually what happened. And it is being collected in the data form from me. That's their medical coder. And for me, if somebody that is wanting to change their career path, perhaps they were doing something else and now they want to switch to this, it is a change. You know, we are learning a completely different language. And think about this also. We are having to know things that doctors know. And doctors who have been to medical school and had years of training, 10, 15 years of training, where we go through a program and in just a matter of a few months, we get certified, right? And when we pass those certification exams, and you know, we're out in the real world and we're coding, and it's incredible the amount of responsibility that we're given. And I think sometimes people don't think about the magnitude of that responsibility. If you are not into the details, if you want to do something easy, this isn't it. This is for people that are committed to looking at the details and getting all of that good information and making sure that it is there for statistical purposes or for, you know, revenue purposes and things like that. So those are the fundamental parts of what we do as medical coders. Do I think anybody can do it? Sure, you know, but then I'm pretty much, when it comes to learning anything new and getting educated and things like that, it is a lifelong learning process, and I understand that. Some people don't want to do that. And they think, well, you know, I used to work in physio and, you know, now I want to do medical coding. You know, is this a step down? Can I do it? No, I don't think it is. But, you know, then I don't know what physio people do. I don't know what all these other professions do. If you're looking into medical coding and you want to do it because perhaps you want to do something where you can stay at home, don't get into it if you want to do it because you want to immediately stay at home. Yes, right now with the pandemic, it has really changed the game a little bit. But if you're looking to do this because you want to do remote coding, you still have to apply at places that you have to physically go. Right now, everybody's being sent home because of this whole thing. And it's just temporary. So just know that if you're getting sent home, it's temporary. They want you to have experience before you get into doing remote coding. Even though, yes, they're sending people home right now, but people are still getting hired as brand new medical coders and just, you know, still being sent home because of the pandemic. This is something that is out of their control, but they still need people. So it's not, this whole thing is not an excuse for new people to not even start, okay? People are doing it all the time. I do have a viewer that got her coding credential, and then 2 months in, she got her first job because she was very persistent. And a lot of times you'll see people who say, well, you know, they do have, where you have to have all of this experience. How am I supposed to get experience if no one will hire me? This is where you have to be active in your approach. And for me, I'm a very active person when it comes to, I rather show you rather than just tell you. I'm not about the talk, I'm actually about the walk. You got to actually do the physical work on it. You have to apply everywhere, regardless of whether they want experience or not. Because sometimes you may get lucky and they may give you a shot, you know, but you'll never know unless you've been applying. So if you do decide to take the leap, and if you even if you were a stay-at-home mom, right, or a stay-at-home dad, and you decide to go ahead and do this, and this is something that you think that you can do, go for it, because moms and dads, they do it all the time as well, okay, even with no degrees. So if you have a degree and you're bringing it in, like I said, pick the things that will showcase your good track record, okay? But like I was saying, doing this because you want to do remote coding is, you're still going to be able to do remotely for right now, but it's only going to be temporary. You have to have experience to be a full-on remote medical coder normally, on a normal basis, okay? But if you are trying to apply with a remote medical coding company right after getting your credential, then you're going to get some resistance, because it's not accepted, okay, on a regular basis. All right, so that is just something to be aware of. And a lot of people will say, well, I want to get into this because of the money. Don't get into it for the money. The money is there, yes, and the job does pay well. Yes, this is a career, not a job, I should say. This career field does pay well, but because of that, a lot more is going to be required of you. Continuing education, paying attention to detail, and looking at all of the rules until you understand. Reaching out when you don't understand. Learning how to speak to providers when something is not clear, or when you start to get better and you start to learn what they're missing, then you're not afraid to go and talk to them. I have many videos out about how to develop relationships with providers. It's something that takes time. It's not something that is you're going to learn overnight, and you certainly do not learn this in school. This is something that you have to train yourself to do. And if in a past life, right, in a past career, you were doing something that had you working with people who have big egos or something like that, that's going to be helpful for you, okay? All that training is going to be really helpful for you. I went through the ABRINGER Institute training. If you're not familiar with the ABRINGER Institute, they have a very unique way of helping you to look at a situation, that it's about the outward mindset. It's not about you. Things are not about you. It's about other people. And when you have this mindset, when you're out there applying, that's really going to help you to get your first job as well, because then you're not going to take that rejection so hard. Is there a lot of rejection when you're a brand new medical coder coming in from another field? Absolutely. Even with nurses will sometimes have this as well, because some facilities don't understand the power of hiring a nurse. To me, I would see the value in a nurse, because the value of a nurse or LPN or medical assistant is you already know like what the documentation should look like. The problem with nurses is that they don't have active applying codes experience, and that is what gets them every time. Well, if you say, well, Blue, I have done coding. Coding in the sense of that you're selecting codes that are already from like a pre-selected list, and you just sort of select those codes and then you just apply them because that's what you normally do. That's not the same as medical coding. Medical coding is actually applying the rules of coding into putting things in order, right, on the record, and putting it as far as like the sequencing and the rationale of why you're selecting a certain level versus another level, or why you're selecting this procedure code versus this procedure code, or this procedure code in conjunction with this procedure code. There's lots of rules. So this is where doing the schooling part will really help you. I've talked about those accelerated programs. There's lots of them out there, and you have to be very careful, guys. Please be very careful when it comes to picking a accelerated program. If you think that you can learn medical coding in just a few months and then take your certification exam, I hope that you already know your basics of anatomy, physiology, and medical terminology. I hope you understand forward and backward the coding guidelines for ICD-10-CM and the CPT, and also ICD-10 PCS if you are studying for the inpatient exams as well. So it's a lot. it's a completely different language. And I've likened it before to learning a different language, because that's exactly what it is. When you get out in the real world, you'll know, because you'll hear it. And I guarantee you, one time you're going to really hear somebody say, and especially it's going to come from a doctor, and they're going to say, "You coders talk another language, I can't understand you." So we are all about rules, and there's reasons for these rules, and these rules get set forth by the governing bodies of this thing. And it's very important to understand these, and it's very important to have a very good hands-on interpretation of what these rules mean. They're in place for a reason, okay? And this prevents a lot of, you know, bad things from happening, okay? You know, things that are not right, or codes that are being selected that shouldn't be, okay? This keeps us from those things. We actually have an ethical standard that we have to follow. And it doesn't matter if you are with AAPC or you're with some other organization. AHIMA's ethical standards of coding applies to everybody, okay, whether you are certified or not, okay. If you are enabling, you have to adhere to those. I will probably leave that link down in the description box below as well, so that way you guys can see it. It is on the ahima.org website. If you want to go back to school through a college, that's great. I also say that you can go through the associations themselves, AHIMA or AAPC. If you want to be a medical coder, you have to go through one of those associations. There's other associations out there, but guys, if you are looking to be a medical coder, those other associations are not going to cut it. These two are the Medical Coding Association powerhouses, AHIMA being the oldest and longest running and most steeped in history. AAPC has a wonderful grassroots movement. They are just as respected as AHIMA, and those are the two that you have to go through. So you have to choose which one you want to go through. And don't try to get a bunch of different credentials because you think it may make you look good. The only thing it's going to do is have to collect more continuing education units. And it gets quite expensive. And there's a lot of people that have just one coding credential and they do very well in their careers, okay? And especially if you're coming from a place where you don't really know what's happening, start with one credential. Getting multiple credentials is not going to help you get a job faster. It's not going to get you looked at even more. What it is going to do, like I said, is make you have to put out more money because you have to have these continuing education units. And they want you to have experience. If you have a huge, long, impressive list of credentials after your name, they want you to have experience. If you don't have anything to back up those things. All that's going to say right there is that you know how to pass certification exams. Not that you didn't study, not that you don't know, but it's going to say at that moment in your career in the beginning is that you can pass certification exams. Okay, so get some experience under your belt, then consider carefully when adding different credentials to your name. Okay, it's very important. Those are the things that I would say are the most frequently asked questions about changing over careers. You can look through my videos. I have lots of real talk videos. I have a day in the life of a medical coder videos. I have it all on a playlist. I have lots of playlists, and I do have medical coding job listings reviewed, like a playlist for that. And it talks about the language of these job postings, because it's the language that's going to get you a lot of times. A lot of people see that they want 3 to 5 years of experience and things like that. They always say like preferred. Preferred does not mean required. There's a difference there. Now, the only caveat to that is when they're asking for 3 to 5 years required. That is the one where I say just sort of overlook that and still apply anyway. Use a really good, use your resume. Use your cover letter of your resume to plead your case, okay? Let them know why. What are you bringing to the table? If you are coming from a different career, what skill set is making you unique that you would bring a lot of really good things to this career field? What is it that you are going to bring to them that's going to help them and benefit them? Okay, that's really huge. And keep your resume to 2 pages, and do not use abbreviations. I am really huge about that. Because your abbreviation may be different from my abbreviation. Spell everything out. They need to be as clear as possible. And if you've got a lot of job history, say your job history goes back 20 years, go with what is most pertinent, okay? Whatever is most pertinent to that position, that's what you're going to have to put on there, okay? So it's very important to spend time around other medical coders, especially in the beginning, because you're going to have lots of questions. I am going to do a video about what book coding and real world coding, how it's different from each other. I talk about that a lot, and it's going to be explained very simply in the video. But just so you guys know, real world and the book, it's two different things. I mean, the book is going to give you textbook. It's going to give you straightforward, very easy things. But when you get out in the real world and you're looking at these records and you're like, well, wait a second, what do I do here? It's all about comprehending what you're reading. It's about comprehending what they're saying. And these things take time. But if this is something that you want to switch a career field into, by all means, go for it. Okay? Nobody can stop you but you. You are the captain of your own ship, okay? And you have to make sure that you are steering in a direction that's going to make you happy. Because at the end of the day, the only person that's going to be in that chair taking that exam is going to be you, okay? And you can do anything. And that's what I always say all the time. You can do anything. And a lot of times people will have that sort of thought in their head, well, maybe it's too late for me, and maybe, you know, maybe I shouldn't be doing this. You can do whatever you want to do. And if it popped into your head for a reason, there's a reason for it. And a lot of times you can't just fight what is put in front of you. If I had fought what was put in front of me, because when I got into medical coding, I didn't even know what it was. I was unemployed and I had gone to the unemployment office, and my case manager, they had given us a whole list of programs that we could take. And they said, if you want to go to school, we'll send you to school. And we have this whole list of programs, and the only thing you have to do is get a job in the field that you were trained. And I said, oh, okay, well, I can do accounting because I love numbers. I mean, I can do numbers in my sleep. You know, I'm big with numbers. And my case manager, he changed the course of the trajectory of my life. He said, well, what about medical coding? And I was so convinced that it was going to be needles. I said, oh, no. I don't do nothing with needles. No, that's not me. And he's like, no, it's medical coding. It's looking at a record and putting it into numbers and letters, codes, and for documentation and statistical purposes for the insurance companies. And I was like, oh, maybe I could do that. And he's like, well, you know, the pay is well, and it's a very steady work, and it's a growing field, and I think you would do really good at it, you know, judging by what you have here. So I said, okay. So I said, well, he goes, just go check out the school and see. And if you like it, then we'll set you up. If you decide you don't want to do it and you want to do the accounting part, well, then I'll make it happen for you. So I said, okay. And going to these schools and having them talk to me and sort of starting to do my research on it, I said, wow, people actually do this? This is actually a career field? And then I said, okay, you know what? I'll go for it. And now look. It's been over 11 years. It's 11 years this year. And I'm still here. And I love it more today than I did when I first started. And it grows. It really does grow on you. But I wouldn't trade my career field for nothing. I only wished that I would have known about it when I got out of high school, you know. That I really wish I would have done. But I didn't know, and I was in my late 20s when I got into it, so, you know, what are you gonna do? But anyway, so I hope this helps. And if you're a parent and you're deciding to do this, and you know, maybe your kids are grown now, and then, or they're still little, and you want to do something different with your life, this is really a good thing, and it's a positive role model position, you know, that you can get paid well and not even have a college degree. And even if you do have a college degree, this is something that is still a good field, okay? So that is my thoughts on it. I hope this helps, and I hope you'll tune in tomorrow for Q&A Tuesday, and I'll go ahead and wrap this one up. So If you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!